Dennis Leary is helping wage war on addiction and minimize its impacts on individuals suffering from it and for those who have experienced seeing their loved ones sick and suffering. Aware Recovery Care is a pioneer in the in-home mental health and substance use disorder treatment industry, representing true innovation. Supported by a specially trained team of addiction professionals, Aware offers a best-in-class in-home addiction treatment program backed by both logic and data. Enjoy. Welcome to the Illuminate Recovery podcast. We shed light on mental health issues, mental illness, and addiction recovery, ways to cope, manage, and inspire. Beyond the self-care we will discuss, you may need the help of a licensed professional. My name's Kurt Neider. I'm a husband, a father, entrepreneur, a handyman, and a student of life. I avoid conflict, I deflect with humor, and I'm fascinated by the human experience.
And I'm Shelley Mangum. I am a clinical mental health counselor, and my favorite role of all times is grandma. I am a seeker of truth, and I feel like life should be approached with tremendous curiosity.
I ask the dumb questions.
I fill in the gaps.
The Illuminate Recovery podcast is brought to you by Illuminate Billing Advocates. Make billing and collection simple with leader in substance abuse and mental health billing services. Verification and analysis of benefits, pre-authorizations, utilization management, accurate claim submission and management, denial and appeal management, and industry-leading reporting. Improve your practice's cash flow and your ability to help your clients with Illuminate Billing Advocates.
Today, we are so fortunate to have Dennis Leary with us. Dennis is a certified alcohol and drug counselor. He is all about creating quality in-home addiction treatment, which is a little bit different than what I typically see. He wants to make sure that anyone who needs treatment across the healthcare continuum have the opportunity for that. So I'm excited to learn a little bit more, Dennis, about what you do, but thank you so much for being here.
It's a pleasure to be here. Thank you so much for having me.
And I know I myself am a clinical mental health counselor, and I've been in the industry for quite a while. I find it a most interesting industry. You find the best of the best and sometimes the worst of the worst. and I don't know if that's probably not the right political way to say that, because I think most everybody's got a pretty good heart and just hasn't always had the same opportunities or learning capacity. So I say that very lightly. I'm curious, Dennis, when you focus on the in-home addiction treatment, let me first ask, I want to come back to that, but let me first ask, how did you end up in the substance abuse industry?
Right. I am a person that's in long-term recovery myself. For many years, I struggled with substance abuse. And when I made the decision, when I had experienced enough pain and I decided to get sober, I went on and I had a pretty successful career. However, I started thinking about what I wanted my legacy to be and how I wanted to be remembered. And I figured that I wanted to be remembered and I wanted my legacy to be, really, I know this might sound kind of, cliche or, but it's the God's honest truth. I wanted my legacy to be, and I want to be remembered for doing my best to leave the world better for having been in it. And so I want to do what I can for my part in this world to help wage war on addiction and minimize its impact on individuals suffering from it and the loved ones who have to experience seeing their loved ones being sick and suffering.
That's pretty profound. And it's very clear that you found a passion for this work and definitely has made a difference, especially with your own recovery story.
Yeah. I feel like I don't feel necessarily that an individual has to be in recovery to be an effective addictions professional. Much like, a brain surgeon doesn't have to have had brain surgery to be an effective brain surgeon. However, I do feel it does add a layer to, another layer to where you can add a little bit more empathy to, you can understand from a personal perspective what the client may be going through at that particular moment in time.
Yeah, agreed. Well, and there's a relatability piece there. They might be able to put one over on some people, but less able to on somebody
Yeah,
that's been there.
yeah. Any story that anybody tries to give me, I wrote that book. I wrote that chapter, so they're reading to me from my own book. So like chances are greater than that. Whatever yarn anybody might try to spin on me, I've already experienced it or said it myself.
Isn't that the truth? So talk to me a little bit about, you've said that you have your own recovery journey. At what point in your life did that happen?
Right. So I started contemplating recovery later in life. I had a couple failed attempts at it, but I would probably say in my mid-30s is when I started, attempting, but I didn't get it until I was about 37. And when I was about 37, I had finally experienced at whatever point, I believe the term when somebody, when we hear in the recovery circles, somebody reaches their bottom, right? I believe bottom is a relative term. For one person, it could be that their child saw them take a sip of beer. For another person, it could be that they got a dent in their BMW while they were drunk. For another person, it could be they were eating out of a trash can, right? So it's just all relative, and every bottom has a trap door because you can always go lower. And so when I had finally reached the point to where I felt that I reached, my threshold for pain, I just said there has to be another way to live, and I have a higher power. I prayed to that higher power, help relieve me of this pain. It brought me to the rooms of Alcoholics Anonymous, and I began my journey one day at a time, and here I am, 11 years later.
Wow, that's incredible. And I mean, these are difficult journeys, right? They don't come. It's not like you just decide one day and it's all over. There's a long road there of lots of learning and challenges along the way.
I would probably say the biggest misconception I had when I was active was that if I was sober, every day would be a parade. That every day was going to be streamers and, oh my gosh, like this is so wonderful. Like it is, it's actually just life. and one might say it can be even a little bit more stressful because when an individual is sick and suffering with an addiction, that's generally the only thing that they're focused on. Yeah. Right? At least that was the only thing I was focused on was, what was I going to do to further my, further my substance use disorder. However, in recovery, for me, what it was like was driving a car and getting into a series of mini accidents until I learned how to avoid them. So it's driving a car, hitting a wall, and backing up, going around the wall, hitting a wall, backing up, and then kind of learning how to navigate so that I'm only scraping the wall. Now I'm just kind of fender bending the wall, and then kind of now learning how to avoid the walls altogether.
I love that analogy because that sounds a little painful.
Well, recovery is kind of, painful when it starts, messy in the middle, and then beautiful when it occurs. Yeah. Because it's a continuum, right? It really is a continuum. And that goes for recovery from anything, right? I always like to give people a framework because an individual that does not have mental illness or, addiction issues, right, might have a hard time kind of comprehending what that looks like. But I believe everybody has struggled with something. How many times has somebody looked in the mirror and say, I can't believe I ate that again? Sitting there, greasy fingertips or crumbs on their shirt and says, I cannot believe I went for the fried chicken or the cheesecake again. I can't believe I went back to that relationship again. I can't believe I put myself in this situation for X, Y, and Z to happen again. I can't believe I got fired from a job again. And at some point, we take a look at ourselves, we take a look at our behaviors, and we make a decision that something has to change. And that's when the healing begins.
Well, I love that too, because I think you've put that probably more eloquently than anybody I've ever spoken with, in the sense that we do not come into this life without the challenges that are present, right? It's just part of being a human being. And so to think that any of us don't need some sort of help, some sort of recovery, it may not be substance abuse, but you're right. It's something. We've got to figure out how to make those changes, and stop doing the same thing that's insanity over and over again, right? So I couldn't agree more.
It's even when you consider like the loss of a loved one or even the loss of a relationship, it's really painful. You have to get through that. You have to recover. You have to recovery from surgery. It's all a continuum. It all takes time. It all takes healing.
Right. Yep, it does. And I'm wondering, I know we talked a little bit about your family, and we don't have to go in depth about that, but how did your addiction and your recovery, how did that affect your family?
Right. So it really impacted my mother most dramatically, I would say. And that I probably would say because, she didn't know where I was. She didn't know what I was doing. She didn't know whether I was safe because I'm an isolator. In my mind, I'm thinking, I'm keeping my family safe by keeping them away from all of my shenanigans or whatever it is that I was up to. But in reality, I'm just creating worry, fear, and anxiety for them because nobody's heard from me, right? And addiction, it's often said in the community, and I subscribe to it, addiction is a family disease because mom becomes a nurse, dad becomes a parole officer, your brother or sister becomes an accomplice because they lie for you, or they become a scapegoat because you're lying about them. I didn't take it, they took it, they must have done it, So the whole family becomes dysregulated when it comes to addiction and after years of that, nobody is functioning in the realm in which they're supposed to be because all the energy goes to the sick kid, or the sick loved one, so mom doesn't have time to also be a wife. Dad doesn't also have time to coach the baseball team or whatever, be the Cub Scout dad or whatever else it is that he's doing because all the energy is being poured into the sick loved one that's suffering from the disease. Or, if it's a parent that's suffering, the other parent, is covering for that parent. So they're doing dual roles. And then nobody's taking care of themselves. Nobody's practicing self-care. So, and that's one of the great things about Aware Recovery Care is that we don't just treat the client. We have a family wellness department that actually works with the family, and so that they can start their own journey and path of healing. And so they have their own team that helps them coach, guide, and assist them along the continuum of recovery so that they can learn how to practice self-care, how to get to self-help meetings. We have family systems therapy once the client has been stabled and is ready to engage in that to help regulate everybody back into the correct assimilated roles.
Well, that's profound, and and I like the way you've said that. It's systemic, right? It's the family. You can't take someone that's dealing with addiction out of the family, provide them with recovery, and put them back in the same system. You just can't. And we've talked about that on this program quite a bit. But I like that you offer that. I'm curious, how many families are resistant to getting that kind of support and help?
So I would probably not many. We have about a 90% participation rate in the family services. And just so you know, family is determined by blood relation, significant other, or identified ally, right? Anybody that's a support to you. It could be your best friend. It could be anybody that's in your life that your life impacts them in a meaningful way and their life impacts you in a meaningful way. That's family. And oftentimes friends are the family that we choose. So if it's a support person and it's an identified ally, that's the person that we work with. And And we've seen great success with it because you're right, it's all about systems. And traditional treatment takes an individual out of their sociocultural environment and puts them away into a designated place for a predetermined amount of time, usually 28 days, crams them full of psychoeducational material and tries to instill coping mechanisms in them, and then sends them back to the same sick environment with a slip of paper that says go to an IOP and hope that enough information stuck within that 28 days that they've gotten it. And it's why it doesn't necessarily have the greatest outcomes. However, that's all we've had, for the past 60 years. It's all we've known. Aware recovery care is a different type of model where we work in the home with the client and the family along a 52-week continuum. That is a lot of time for change, right? And so we are continuously working with the client, continuously working with the family, and the other key differentiator is we pull in all the client's community providers. So we're also working with the dentist if there is one, the lawyer if there is one, the parole officer, the PCP, the mental health counselor or therapist, the psychiatric provider, and we're asking for input from all these lenses, and that's how we're generating our clients along with the client's strength-based treatment plan, because we're addressing every issue that the client has from a whole-bodied person lens, because we want to address not only them from a biological, psychological, and sociocultural point of view, we want to address their social determinants of health at the same time. Because by doing, addiction is a very complex and multi-pronged disease. It needs a multifaceted treatment approach. And we believe by doing and operating treatment in this way, by facilitating treatment in this way, that we're not just treating addiction, we're removing barriers to recovery.
Absolutely, Dennis. I mean, I love the way you describe this dynamic, because you're right, it is very complex. And if you don't bring in support networks, right, people who know that you're in recovery, so one, you take away the darkness and the hiding and all of those pieces, the shame, and you shed the light on it, and you bring everybody into that place of healing and recovery and support. So
That's right.
how healthy? I mean, that's super healthy. And I would imagine what I heard you say is that people, parole officers and corrections, and I would imagine even insurance companies, do you take insurance payments?
We do.
I would imagine that those organizations are watching what you're doing and really getting on board with that dynamic, with that, that multifaceted approach.
Oh yeah. Well, so I can tell you, our one of our payers, which is one of the largest insurance companies in the nation, released a report that showed during our program and for a year after clients that completed our program, that not only when we do our follow-ups, not only are clients staying sober, but their emergency room visits are down, their psychiatric admission, their psychiatric visits and inpatient stays are down vastly. Their residential stays, their readmissions into traditional treatment, all of them are down by significant numbers. And this is over 19 consecutive quarters.
That's impressive. And so insurance companies they pay attention to those kinds of things.
Oh, absolutely.
And it makes a difference. So how willing are they to pay for 52 weeks of treatment?
Right. So we partner very heavily with Anthem Blue Cross Blue Shield, and they're wonderful. Because they see the benefit, right? Yeah. And they see the benefit, and they know what the program does. They see their client lives getting better. And other insurance companies that we've worked with, Anthem Blue Cross Blue Shield, Tufts, Florida Blue, Blue Cross Blue Shield of Massachusetts, VCCN, which is a Veterans Care the Veterans Administration Network, and we also work with Beacon and Unicare. And and other insurance companies, we've had great success with out-of-network benefits and single case agreements.
That's incredible, and
it's only a matter of time. It's only a matter of time before all the other insurance companies come on board.
Yeah, I mean it is. It's you have to start somewhere, and you've obviously started with your closest ally, right, in the insurance industry world, anyway. And then it branches out from there because I happen to know that in this industry, which I am very closely connected with, right, of the insurance payments, that insurance companies talk, like they're paying attention and they talk to each other, and so what happens at one, it's just going to trickle down into the others. So
Yeah, they're going to want to know. Well, so hey, if Aware is doing this for you, what can they do for us?
that's exactly right. And so it starts to really exponentially grow after you've done it a while, right?
Yeah, because at the end of the day, right? Not only do we as providers, but insurance companies want to see their patients living healthier lives. They want that. They have a ton of any insurance company you go to these days, they have a ton of wellness programs. They have all these programs where you can call up and you can speak to a nurse and a wellness consultant and a coach, and they give you rewards and points for going and getting your physical screenings and all these other things. And they reward you with things like money off your premium and points that you can redeem at their store and all these other things. So they're really promoting health and wellness. And addiction costs this country, when you think about it on a greater scale, in terms of when you think of crime, when you think of public assistance, when you think of just the whole host of other sociocultural factors, billions of dollars a year. And so any way to reduce that and reduce health costs across the per capita healthcare costs across the continuum, that's really what it's about. And that's a win for everybody, because then premiums go down, equity in healthcare goes up, people have more access to care, healthcare is more affordable, and so it's a win-win across the board for everybody.
Yeah, I could not agree more. And the fact that you're also, dealing with the systemic or the family dynamic, you're breaking, these cycles of addiction and abuse, and you're going into the heart of the dysfunction, and you're working with them to, take away the shame of that and help them learn a different way of being together and having more happiness and greater, satisfaction in life and their relationships. So I can't think of too much that has more of an impact than what you're doing with these families.
Yeah, in the high 90s, I don't have that exact number in front of me, but a client satisfaction survey, it's the high 90 percentile said that as a direct result of being involved in our program, that the relationship with their families improved.
I'm blown away. Let me ask you this. So is all of your treatment with Aware Recovery Care, is that all done in the home? Is it all based in the home?
It is. We actually have in-home withdrawal management, which is what the industry would call detox, but we are very client-centered. So we will help a client withdraw from their symptoms in-home, and that's done by medical staff, by nurses, and by addiction treatment staff. And we have our standard 52-week in-home addiction treatment program. We have in-home medication-assisted treatment, so we do in-home Suboxone, in-home Vivitrol, and we provide that as a bridge while we source community providers for our clients, because we're very community integrated. By the end of our program, we want to have worked our way out of a job. We don't want the client to be reliant on us. We don't want the client to be reliant on our providers. So we patch the client into the resources in their community so that they can function and assimilate into a recovery-oriented based lifestyle in their community where they live from the safety of their own home. And they're doing that without having to leave the things they love. So their comforter that they've had since they were however old is still there. They're not leaving their pets. They're not leaving, their significant others, because let's face it, not everybody can go away for 28 days. That's not a realistic option. We have single mothers. We have, business executives. We have people whose jobs depend on them being there and they can't leave for 28 days. But because we have such an innovative model, we can meet the client before work, on their lunch break, after work, on the weekend. So our motto is meet the client where they're at, and we do that both, physically, emotionally, mentally, where they are and whatever stage of change they are. That is our motto. Wherever you are is where you're supposed to be, and that's where we're going to meet you.
Wow. That is so cool, Dennis. It's very powerful to think of the lives that you're changing and the communities that you're changing. Um, I'm just trying to wrap my head around this idea of I don't see very many programs that go into homes. There are some, but I don't see a lot that really focus all of their energy there or that have been able to do it successfully.
So we have had great success on it, and I would think that is due to one, our model and our concept, the culture of our agency, the training that we put our staff through, because it's for being an IHAT clinician or an IHAT certified recovery advisor, or an IHAT care coordinator. All those things are different in the home. You can be a behavioral health clinician and be working at a traditional agency. It's very different from being in the home. When you're doing that in the home, we teach the standard things, infection control. We're Joint Commission accredited, dually Joint Commission accredited in both behavioral health and home health. So we have the standard policies and procedures surrounding that, safety, infection control, so on and so forth. But among that, we're taught to be observant. So you're looking for signs of dishevelment. You're constantly assessing the client for changes. You're looking at the different dynamics that are within the home, because that's where it all happens, right? And so if a person doesn't have recovery at home, they do not have recovery. If you don't have peace and serenity and you're not feeling safe where you live, then you are not safe and you do not have recovery. So we will do our best to make that home a safe treatment environment. And if we feel like we can't regulate it, we will then have the client placed in sober living or another place where it will be safe for us to give treatment to the client.
Wow. How much of your treatment modalities, how many of the providers provide treatment through telehealth?
So we have a split schedule right now, right? We never really went fully remote. So we were already a mobile-based company anyway. So we had telehealth before people really were, what's telehealth? We were already using that. And so when COVID hit and the lockdowns occurred, we were well primed for that. We already had that. We already had the technology and protocols in place, so it wasn't really that much of a short stretch. As time goes on, we were able to lift our own restrictions and modify it based according to the CDC guidelines, and we have a vice president of our integrated health who works with our compliance officer to make sure that staff and client safety is paramount and above all else, right? And so we have them on a staggered schedule, and our program starts out fairly heavily in both visits and clinical intervention, and then gradually drops down over the course of the year, so that by the end of the year they're seeing us one time a week. And so if a client is seeing us one time a week, that's going to be a face-to-face visit. However, during the first 2 weeks, it's five times a week that we're seeing the client. That's going to be a blend. So it's going to be a blend of telehealth and in person.
Nice. And I think it's a good balance, because you still need to see them. You need to be able to assess things you can't do over telehealth, but telehealth can fill some of that space.
Like right now, if this was a telehealth session, I see exactly what's in front of me, right? If I'm in the home, I get the whole picture. I can see everything that's going on around you. Wait a minute, this isn't really like you have dishes in the sink, what's going on? Wait a minute, the house is looking a little unkempt. It's really easy to tidy up one area and make it, appear okay, right? But physically in the home, you get to see everything. What's going on with it? Is your husband there? Is he yelling? That's where a lot of the visual aspect and the assessment comes from, is what's going on in the home.
Yeah, absolutely. And I love that combination. Go ahead.
The other thing I was going to say is, because the other thing that's really key about working in the home with the client is, we know, traditionally speaking, and I'm sure you can relate to this because of your time in the field, it's not often that change with the client occurs in your office during the session. It doesn't, right? Change happens outside of the office when the client is back at the, wherever it is that they're doing, and trying to implement those skills when faced with negative life experiences, negative peer group associations, or triggers. That's where we come in. And we're kind of like that second shift of whatever the medium or intervention dynamic is happening in therapy, with the doctor, with the prescriber. Because remember, we're collaborating and taking those interventions. We're carrying them on. Okay, the client's struggling with medication adherence. We're going to talk about medication adherence this week. We're going to keep going. We're going to build you out a schedule, and we're going to do that in the home, right? Until that sticks, right? And so, like, now we've got a routine set up, because that's where the change happens. Medication adherence happens at home when the client's got to take his medication, not when the doctor's talking about it to him for the 15 minutes in the office.
Right, which is reality, right? You're taking it right back to the reality of and the space where things happen. And like you said, there's a place for residential treatment where someone leaves their environment and goes there, but not everybody can. But you're leaving them in this environment that's triggering. Instead of taking them out of it, they're having to learn how to deal with it in the moment more than if you remove them from the environment.
Yeah, exactly. Because again, we're about changing that home environment, right? We're about changing and making that home environment safe, so it is not triggering, so that it is peace, so that it is serenity, so that home is a safe space. It's a refuge for you. It's your sanctuary. It's where you go to reflect. It's not where you go to be stressed. Stress is for everywhere else. You have that at work. You have that in the community. You have that over here. You don't have that at home. Home is for peace.
Nice. I love that. A safe place to come, a safe place to retreat to and find safety and support as opposed to chaos.
Yeah, that's your cocoon. That's your safe, happy place. Home is your safe, happy place.
And I imagine I would imagine that would take a good year or more just to change that system and dynamic that's been going on in that home for years and years.
Well, it's recovery from anything is a lifelong process. It's never a one and done. It's never like, okay, I'm cured, right? It's it reaches a maintenance stage where you got to tune yourself up. You got to keep yourself going. However, it's never done, right? Because the moment you stop growing, you start stagnating. Mm-hmm. And when you start stagnating, you start regressing, and those old behaviors start creeping up. Because there's a saying in the recovery community, and I subscribe to it, is that while you're sitting there in recovery, your addiction is doing push-ups, and it's getting stronger and stronger and stronger and stronger. And addiction doesn't come to you flat out in the open and say, hey, Dennis, this is your addiction talking. I think a drink would be really good today. Your addiction comes to you in a real smart voice that says, you know what? It's been really stressful today. Oh gosh, a beer would be really nice today. That's how addiction talks to you, right? It doesn't come right out. It kind of sneaks up on you in small doses. And unless you're maintaining those coping skills and those maintaining the things that help get you sober, you can become stagnant and regress. Because remember, relapse is a process, not an event. The actual picking up of the substance is just the period at the end of a very long sentence. If you trace it back and do a chain analysis on it, you can figure out where the relapse happened was actually 3 months before you ever picked up the drink, and when you stopped picking up your phone call from your support network or from your sponsor or whomever you choose to call that person.
Yeah, super. That in and of itself is a skill to be able to trace back, right? To see it didn't start here when I picked up the drink. It started way back when.
Yeah, and helping the client see that too, mm-hmm, right? Mm-hmm. And helping the client understand. Oftentimes, our clients are, individuals in recovery or that have had other experiences too. They're so used to being penalized for having a recurrence or for having a symptom of their disorder return. And like, we're a non-punitive agency. So we believe that a recurrence is a reason to reevaluate your recovery and take a look at it. Because generally it means you were doing too much of this and not enough of this, or all of this and none of that. And it means your recovery needs a tune-up. When I have a client that's struggling with, some behaviors or whatever, I don't even ask about the relapse. We know about the relapse. We know what you did. Tell me about your recovery. Tell me about what that looked like, because that's what I want to know about. Let's talk about where was it unbalanced, because I can guarantee you somewhere in there it was unbalanced, because nobody goes from stable recovery to using overnight. It does not happen.
It happens to observers because that's all they see, but to the person who's actually, ended up relapsing, they can trace it back, right? Every time. Have you ever seen where they can't trace it back?
No, I've never seen it once. You might have to help them understand a little bit what you're looking for, but then he'll be like, okay, wait a minute. I started smoking cigarettes. Then I stopped going to meetings. I stopped taking phone calls. I started isolating. I quit my job. I got involved with this relationship. The relationship was very toxic. I started arguing. And then then you can start seeing. Uh-huh. I like to draw a hill going up to how you got to recovery, and then the pinnacle being when you reach, whatever point of sobriety, and then a hill going down. And I outline, okay, so you did this, you did this, you did this, you did this. Now we come up with ideas and barriers. Because if we put a barrier here, you would have never reached here. So the idea is to put as many barriers between you and the actual picking up of the substance, so that you have interventions that you can rely on.
Super powerful. I'm curious, you said that you also do the detoxing in the homes. How do you safely, and I know you're going to have a great answer for this, how do you safely detox somebody on alcohol and benzos?
Right. So we use the American Society of Addiction Medicine's criteria, right, with all of our assessments and all of our scale ratings. And so we're able to safely help somebody withdraw from their symptoms if they score at a moderate or a mild level. Severe, we would have to refer out because it wouldn't be safe. And so we issue evidence-based assessments, CALS, CWAS, and based on their scores, nurses go out on a rotating schedule, take vitals. Comfort medications are prescribed on a daily basis so that there's no risk of, taking more than what you're prescribed, because you're only prescribed what you need for the day. And so, and then our recovery services department goes out, and everything's tailor-fitted to the individual. So if the individual is in the InHome withdrawal management level of care, the interventions that we're working on that client with are basically like, what are you going to expect and how you're going to deal with it. So, the truth of the matter is early recovery does not feel good, especially if you're withdrawing from something. So let's talk about how we're going to deal with that, and we teach them holistic and alternative methods.
Very cool. And powerful too, because again, if you need a hospital stay, if you need an ER stay or a detox stay, then of course that's going to be what you prescribe. But if not, if they can meet at a lower level, then you provide the services they need to do it safely.
We have an obligation as treatment professionals to give the client the proper level of treatment in the least restrictive level of care. That's what we should be striving to do as addiction treatment professionals at all times, giving the proper level of treatment in the least restrictive care. So, if a client does not need to go away, why would we want to send them away? There's no need for that, right? If the client does not need to go away to 28 days and can safely receive treatment in their home or community-based support, why wouldn't we do that?
And so it sounds like you're providing all levels of care other than a residential, and the residential is really just taking place in their homes, which... Go ahead.
Well, so there's, again, according to the ASAM criteria, we treat people that would traditionally be in an IOP or down, an intensive outpatient level of care or down. So if somebody requires if somebody would require residential stay or they scored that high, we would not, it would be inappropriate for us to have them in our program. We would ask for them to go to a 28-day program and then step down to us, and we would continue the care from there.
Oh, fantastic. So you've probably got a lot of feeders from some of these residential programs as well, I would imagine.
We have relationships that we've established with preferred people that we work with on a regular basis, where we have a working relationship with them, to where, like, we're safe and we're comfortable, and we know the institution, we know the people that work there, and we will refer clients that are in need of treatment there, and then take over their care at discharge, because we start planning for their integration back into with Aware from the moment they go to that program.
I love it.
We also have an internal higher level of care, which means that if at any point during our continuum a client suffers any setbacks or has any struggles and requires additional services, they can be bumped back to a certain phase at no additional cost to the client.
Which is supporting them, right? It's supporting that recovery for what recovery is. It's an up and a down.
Yeah, and so every time I see an individual walking down the street with a garbage bag, I'm wondering what treatment center they got kicked out of. Because generally speaking, addiction services is one of the very few parts of the medical community where punishment is the treatment of choice for the disease returning.
Yeah. And it's a catch-22, because if you're living at a facility and you're using, it's not safe for everybody who's there. But at the same time, what about this, this person that's still struggling with this illness of addiction, right?
Yeah, exactly.
It sounds like Aware Recovery Care has been around for a really long time, from what I'm hearing, and that they're very well established. What's the size and longevity of this organization?
So we were established in 2011, and then we had a proof of concept done with 2 addiction psychiatrists out of Yale, and then we started in Connecticut, and then we started expanding, and we're now in 6 states. We are in Maine, we're in Massachusetts, we're in Connecticut, we're in Florida, we're in Indiana, and we are in Florida. And then we have plans to expand to Pennsylvania, New York, Rhode Island, and Virginia, all within the next, upcoming year to year and a half.
Wow, that's pretty aggressive growth as well.
Well, again, our insurance partner has seen the impact that we've had on not just the opiate epidemic, though we've had a tremendous impact on the opiate epidemic with the clients that we serve, but also with the general substance use disorder population that comes to our program. And, if we could be everywhere, we would be. But we need to scale and build that out and make sure we have properly trained staff in our model, make sure that, so that takes a little bit of time. But to think about, in the 5 years that I've been with the company, to go from 1 state to 6, that's, it's pretty significant.
Yeah, it is. It really is. And so it brings up another question in my mind. It seems like that COVID particularly escalated this, is that there seems to be a shortage of healthcare providers, therapists, substance abuse counselors. Everybody in that industry seems to be taxed, and it's a little bit hard to find the quality of person that you may want. How are you guys addressing that piece?
So for us, we have an average turnaround time from referral to start of care of 48 hours. So we're very quick turnaround time with starting our start of care. And we generally don't have a problem. So all of our clients are, part of our program is that, you must be involved in therapy. You must be involved in, every client has the right to choose or not choose what they want to do with their life. But if you want to be in this program, we have to be in this program, and therapy is part of that program. and so right, and as well as, getting routine health care and all these other things, right? And so we have partnerships with therapists all over each state that we've been in, and psychiatrists and PCP practices and medication assist, addiction medicine doctors, and and so we really don't have, we're not seeing that effect, right? Because we have these relationships built. We also have, in a very worst case scenario, we have in-house therapists that can provide that if needed.
Wow.
Again, our preference is external because we believe in community-based providers.
Right, because that's who they're going to stay with. It's exactly
Yes.
what you said, right? We don't want them dependent on the organization. We want them integrated into the community and a safe place to be. So
Exactly.
I like that. It's impressive, and I can tell that it's a fairly mature process and system.
Yes, absolutely. A lot of time, effort, thought, and energy has went into developing it.
Dennis, do you have? I'm absolutely intrigued with this conversation and where we're going. And we're running out of time, but I'm curious as to if people want to connect with you, especially with the growth and the program that you offer. People are going to want to be able to connect with you, and where can they get you?
Right. So my email is dleary@awarerecoverycare.com. My phone number is 203-631-2556, and you can always visit awarerecoverycare.com.
I always am quite impressed with people who are willing to give their phone number, which means you're not afraid to pick up that phone and talk to anybody who needs some help.
I am not. That's why I'm in this business. I had a person call me yesterday and tell me that I am calling you and I'm sitting in front of a liquor store and I don't want to drink. And those are the calls of why I got this job, right? That's why I do what I do. And we talked for about 20 minutes. I asked him to pull away from the liquor store. He did. And then we talked about how to get him into treatment. Like, this is what I do. And I love doing it.
I can tell you love doing it, and you're super passionate and you're super educated and knowledgeable about it. So thanks for sharing your wisdom with us today. It's been absolutely incredible for me. I've enjoyed your stories. I'm sure that you have a lot more to tell, but for this particular episode, we're going to call it and just thank you so much.
My pleasure. Thank you for having me.